Hey, welcome all our Facebook viewers. I'm Dr. Ann Zedlitz, and I'm a board-certified dermatologist in Baton Rouge, and we're going to be showing a demonstration of Ulthera live on one of my willing patients, one of my favorite nurses, actually. Her name is Lisa, and Ulthera is something that's been around for quite a number of years now, and not quite 10, and one of my favorite procedures. I have it done every year on myself. There is not a better lifting procedure out there on the market. In fact, FDA approved, it's the only one out there that's FDA approved for lifting. And that includes all of the devices out there. Radio frequency devices, any of those devices. This Ulthera machine is the only one that has the indication for lifting out of all of them. So it's my gold standard I go to for lifting. And you know, as you get 50 and over, you really have to do things. But my therapy started when I was in my 40s with Ulthera. And in fact, I have some patients in their 30s that need to start. So Lisa is already ready to go. Her face is marked where we're going to do it. We're doing the brow lift on Lisa. Lisa has beautifully arched eyebrows, but she didn't start that way. She's been doing Ulthera for many years now, and we keep her eyebrows lifted. And we do it about once a year, Lisa, would you say? About once a year. And so, but I see quite a few patients now in their 30s. They've had so much sun exposure that they have to start these tightening devices a decade earlier, where most people may start in their 40s. So the more sun exposure you have, the earlier you need to get started. So sun exposure is expensive. Genetics plays a key role, sun exposure, and how good you are to your skin. Do you protect it with sunscreen? Do you put your vitamin C on? Do you smoke? Environmental factors play a huge role in it. So we're going to lean Lisa back and get started. Heather is our nurse. And Ulthera is almost for everyone. Men, it's great to help accentuate the jawline. It helps beautifully for décolleté in women. I had my procedure done the week of Thanksgiving this past year. And what's great about Ulthera, there's no downtime. It bypasses the skin surface and goes deep. And it produces heat that helps build collagen and elastin in your skin. As we age, we lose it. We lose the firmness. We lose the tightness of our skin. Everything starts to sag. Some people faster than others. Again, it's genetics. It plays a big role. But this is one of the best things to help fight Father Time. I love it. And I'm going to show y'all in a minute here what Heather's seeing on the screen. This is ultrasound that delivers the heat deep to precise levels of the skin and multiple levels of the skin, depending on where you are on the face, neck, and chest. Why is that important? Well, we want to help strengthen that skin. It's the scaffolding. How do we make our skin tighter? How do we lift things that have started to sag? It's all about the collagen, baby. That's what I say. Cardiologists care about your cholesterol. Dermatologists care about your collagen. So we want to build that collagen. We want your collagen levels through the roof. One of the things I recommend, and I do daily, is vitamin C, 1,000 milligrams twice a day. You can't build collagen without vitamin C. We want that vitamin C. So not only do I apply it topically, I take it orally also. And one of the new spokespersons for Ultherapy is Christie Brinkley. Gracefully does she age, if at all. But one of her secrets, and she's done it over the years, is Ultherapy. Again, it's natural. It's non-surgical, so you don't have any scars. There's no really downtime. Sometimes you may get a little redness that lasts a few hours. Sometimes, if you have lidocaine injected, you may get a bruise. That's rare. And then, so Lisa, right now, how much pain are you in?
Very minimal.
Scale of 0 to 10, 0, no pain at all, 10, the most pain you've ever had in your life.
0.5.
0.5. Okay, so we get 0.5. So what I did was inject some numbing medicine on Lisa prior to starting the procedure. She also has some topical lidocaine on. The other thing we can do is give you some medicine by mouth if you want to be totally relaxed. I know I like that sometimes, but you have to have a driver that comes to the office. So this is the eye procedure. And as Heather goes around, she moves this transducer. You can see this device. she moves it ever so slightly and delivers these pulses of energy, this line of energy that delivers these pinpoint pulses of heat delivered to a certain level, and that's the key. What level does she deliver to? And I'm going to move this screen so all our viewers can see. This is what she's seeing in real time. It kind of looks like when you have an ultrasound when you have a baby. And you can see the different levels of the skin, and this line is where she's delivering it based on what transducer she's using. So that's what she's seeing. So again, it bypasses the skin surface, so there is no downtime. This is the machine that I use that delivers the depth that I want. What tightening do I want? Where do I want my tightening? Do I want the eyes lifted? Under the eye, crepiness? If I deliver the energy higher up in the skin, it helps more with the crepiness. If I want more lifting, I deliver the heat deeper. So that's around the eyes. The jawline, the cheeks, around the lips, those lipstick lines, this is one of my go-tos. I do it at least every 6 months on my lips. Sometimes you can do it every month for 3 months and then do your maintenance of every 3 to 6 months. One of my favorite procedures, and again, there's no downtime. There are not many procedures out there where you can say that. That's beautiful. The other thing is right here, I know I had a problem with this, my turkey neck, so I had to work on it a few times. Now my maintenance is once a year, but initially I did it at a 3-month interval, did it once, then at 3 months, and then at 6 months. So I did 3 of them in a 6-month period. Now I do 1 a year, but it helps tighten this area of the neck. Everybody's different. Some are blessed genetically and they don't have to do anything in that area, but other people, they inherited a lot of things that they love from their mom and dad, but the turkey neck may not be one, and so they have a little more work to do. So this is great for on the neck. Jawline. Lots of people, we start losing our jawline as we age. And the majority of aging, you kind of age slowly. The slope is rather slow in our 20s, mid-30s. That's when the slope is very steep on the aging curve. And so you may not notice it. I'll notice it because I'm going to pinch your skin and I'm going to feel with the thinness and the inelasticity of the skin. But so we may start early in the 30s before you start to notice it, because you don't want to get to the point where you're playing catch up. Think about your house and all the maintenance on a house over 10 years. If you do nothing, paint, roof, you want to do your maintenance slowly so you stay looking good as you age. We want to set back Father Time and then teach him how to tick a little more slowly. How are you doing, Lisa?
Great.
Give me a number.
0 right now.
Oh, 0. Okay, we're doing better. All right. And this procedure, usually it takes about 30 minutes to an hour when you're in the office. And that's the entire procedure. So, and there's no downtime. So you can go back to work. You can put on makeup immediately after. So who's a candidate? Almost everybody. So Ultherapy in your late 20s, depending if you inherited saggy or low set eyebrows, I've recommended it to people in their 20s to help keep that arch or start preventing it, because in 10 years they're may need eyelid surgery because they haven't addressed the sagging. And so I think this is preventative, and it helps treat the issues that you have, and it just helps you stay young longer. So again, it differs from the different energy devices in that there's no downtime because it bypasses the skin surface, and it delivers heat at exactly the level you want. Everybody's different. Some people have thicker skin. Some people have more crepiness. So we look at the person and individualize your treatment. And as a provider, you really have to know what you're doing. Years and years we've done this. We know exactly what level we want, how many lines we're going to put there, because the lines are the key. You want more lines. Some people, you may read online that, oh, I don't think Ultherapy worked, or there were some bad reviews. Well, why? Well, I believe firmly that it's the provider who did it, because they didn't deliver enough lines. It's all about the lines. You've got to deliver enough heat to really make a change that you can see. You're building that collagen. You're forming a new foundation. You know, some people, the analogy is to a mattress. Over time, your mattress gets deflated. What's going to build it up? You need to build up those levels of collagen that helps give you the support of your skin. And how long do you see results? How long does this take? Well, you're going to see a little swelling immediately, but that's not results. That's just temporary swelling. Some people see it in 2 weeks. You start seeing it, I know I do, on me, usually about a month you can start seeing a difference. You feel a little tighter, the eyelid's a little more lifted. I notice when you put on eyeshadow for me. But full results in 6 months, good results in 3 months, because it takes time to build the collagen. It's not going to be immediate. Well, that's a good thing in my eyes, because I don't want results overnight. We want them gradually. We don't want anyone to know we've had anything done. So gradual, I think, is the best. And then, what about other parts of the body? So we talked about the eyes, the cheeks, the jawline, submental here under the chin, the neck, beautiful. The chest. I know I have wrinkles on my chest area here in between my breasts because I sleep on my side. And so I do this for my décolleté area, and I won't have any more wrinkles. It's beautiful because I can't sleep on my back. That would really help, but I'm a side sleeper. So I really like it for the décolleté. Those are the FDA approved areas. We've used it off label for some other areas I know I have on myself trying, because if it works there, maybe it'll work elsewhere. On the abdomen, I've worked on the back of my arms, and they work in some instances, but there's no FDA approval, and it's a case-by-case basis, so we'd have to see. And then, Lisa, how we doing?
Great.
Great.
0.
Good. Heather, any problems or complications?
No problem.
Pretty
Very
easy
easy
procedure.
treatment.
Yeah, you're just looking at what level you want to deliver
At what
the lines,
level?
huh?
Yes.
All right. And then, how do you know if you're a good candidate? Well, that's a great question, because not everyone's a candidate. As we age and we get older, in our late 60s and 70s, our skin doesn't spring back as fast, and we all know this. And we don't make collagen as well either. So the younger you are, the better the results for the most part. But everybody's skin is different. I see some people who have great skin in their mid to late 60s, who would be a great candidate. I see some people in their late 40s, early 50s who have paper thin skin, who really have poor genetics, have not used sunscreen, who smoke, who really have so much damage, they may not appreciate the results as much. So again, it's individualized, an individualized consult. And we decide on a case-by-case basis who would benefit. But again, generally the younger you are, the better your results, the less number of treatments you need. And if you haven't done anything on your skin for a while, you may need more treatments because you're playing catch-up. Just like the analogy of a house. If you haven't done any maintenance on your house for years, decades, you're going to need to play a little catch-up going forward. All right, so, and you can see, can we see on the screen Lisa's skin and how, let me see here. So we've done these areas here. And have we done under the eyes?
Not
we
yet.
didn't do that. So that's just from my numbing under the eyes. And there's no difference on the skin surface. And those are just our markings on what areas we're not going to treat. All right. Good. So for our viewers today, if you like our Facebook page and you leave a comment, you get 20% off all Ultherapy treatments. So any Ultherapy treatment that you want, 20% off. And this has been a great educational experience, and because it's so hard to know. When I first had Ultherapy, I didn't know what to expect, so I did it without numbing, I did it with numbing, and I highly recommend the numbing because it can sting a little bit. Again, the treatment cost, it depends on what area you're doing. It can range from, if you want to do above your eyes, $750, and that's without a discount. Whole eyes, maybe $1,500 or $1,200 to $1,500. It all depends on how many lines, how big your eyes are. And then lips, about $500 regular price. And but we can go through all of those prices. You can call or email us, and we can go through all the prices. Again, no downtime for Lisa. She'll be working this afternoon. 5 minutes after we finish here on the table, she'll put her makeup on and she'll go back to work. You can have a little swelling around the eyes sometimes, depending on how many lines we put down and how lax your skin is. Do you have any questions from Facebook, or anybody have any questions? Lisa, do you have any questions, or a lot of questions that patients ask? Any questions that patients ask?
No, typically you've answered them. How long will it take to see results? And that's patient dependent, I always tell them.
Yes. Oh, I know one thing. A lot of times patients come in with uneven eyebrows. That's very common. In fact, I think asymmetry is the norm with eyebrows. So what can we do? We can actually lift that one that's a little bit lower to match the other side. Love it. Do it all the time. And usually you'll notice your eyebrows are asymmetrical when you put on your glasses and you see one eyebrow above the other, like on your sunglasses or something. So how are we doing with time, Dane? You doing good? And how are we halfway through the treatment?
We're about halfway through the treatment now.
Halfway through the treatment. It's been 15 minutes maybe. We're halfway through, so 30 minutes, 30 minutes. Depends if we're going to do the under eye. It may take another 15 minutes. And then I usually like to do filler about a month or so after I do Ulthera. We got to build, we want to attack the aging process at different levels. Structurally, we want to lift and tighten with Ulthera. Then we want to fill, if you've had volume loss, we want to fill where we've lost it over time. And then sometimes the textural changes or the pore size in different areas, we can address that even more with other machines. But crepiness under the eyes, Ulthera. Lipstick lines, Ulthera. Jaw tightening, submental, that turkey neck, Ulthera. Eyebrow lift, home run. Décolleté lines, love, that's my home run. In men, that jawline, to get that great, strong, muscular jawline, usually they come in every 6 months, once a year, just to get that treatment, just to keep the jawline. So, have fun, wear your sunscreen. Dr. Z out.